Hello, good afternoon. My name is Dr. Chudi, Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to today's YouTube live stream. Today's topic is going to be on unexplained infertility, or what we call infertility of unknown origin. Unexplained infertility or infertility of unknown origin. And today, to discuss this topic, we're going to look at key factors, key things you need to be conversant with, and how to achieve pregnancy even with unexplained infertility. Now, we're going to use this as a guide to tell us where to go if you were given this diagnosis. Now, first of all, for us to come to the diagnosis of unexplained infertility, there are a couple of things we need to be conversant with. Number one, we have to make sure we've done all the basic fertility tests for the women and for the men. So that's number one criteria. We would have checked this whole body of a woman from the vagina up to the tubes, to the ovaries, to the womb. We have to make sure that we have ruled out all possible problems. So we must have done HSG, we must have checked the hormones, we must have done an ultrasound, we must have confirmed that the woman is completely okay, that she doesn't have any problems. Now, if we confirm the woman is okay and she doesn't have any problems, that's unexplained infertility on the side of the woman. Now, when we come to the side of the man, we would have also done our fertility assessment. Remember that infertility is defined as the inability to achieve pregnancy for a period of 1 year in a couple that are making love consistently without protection. Now, there are little modification in regards to age. If you are above 35, it's actually 6 months. So the 1 year duration is for women below 35. So for you to have unexplained infertility, it means we have checked you as a woman, we've checked this body, and there is no problem. You are confirmed okay. We have checked your partner, and there is no problem. We have confirmed that your partner is okay. But still, you are not able to have a baby. So let me put you into context. You are 25. Your partner is 35. So the woman is 25. Her partner is 35. You guys have been together for 2 years. And for that 2 years, you've been making love without protection. And after the first year, you couldn't become pregnant. Then you went to see a fertility specialist. And we took time to check your whole reproductive system as a woman, no problem. We took time to check your partner, no problem. Everything is okay, but still, you are not able to become pregnant. At that stage of ruling out any particular diagnosed fertility problem from both of you, and you're not able to become pregnant, it's at that stage you will be confirmed to have what? Unexplained infertility. Now, if you are above 35, let's assume you're 37, and you have done exactly the same thing I explained for 6 months, and you don't have good outcome, and we don't have any particular diagnosis, then at that stage, we can also say you have what? Unexplained infertility. Now, what we're going to do today is to look at ways you can achieve pregnancy even with unexplained infertility. So this is what we know. Unexplained infertility by itself is a very frustrating diagnosis because we've done all the expensive tests. Unfortunately, fertility testing and fertility assessment is expensive, both for the women and the men. There are so many investigations you have to go for, and they are expensive. So when you've spent all this money and we don't know the particular problem why you don't have a baby, and you still don't have a baby, it can be very, very frustrating. So the question is, what do you do when all the tests come back normal and yet you're not pregnant? So we're going to follow the steps, which is expected. So number one, we have to go back to the drawing board. So we have to investigate again, make sure that whatever we got prior to that particular diagnosis is still the same. So when we go back to the body of a woman, we're going to start all the important fertility testing for her. Then we go back to the man and also conduct all the important fertility testing in the man. For the woman, we have to confirm she's ovulating. We have to confirm that her fallopian tubes are good. We have to importantly confirm that her ovarian reserves are normal. pelvic ultrasound is good, thyroid hormones and all the important hormones are good. Then for the man, importantly, we have to confirm that the seminal fluid analysis is good. So the criteria for seminal fluid analysis is to look at the count, the motility, and the morphology. When we have confirmed this, that's step number one. If you still are not able to arrive at a particular thing, then we have to escalate. We have to begin different fertility treatments. So number one fertility treatment is to consider using oral fertility drugs. So this might be the junction we will have to start using Clomid or letrozole or a couple of other drugs. The essence of using Clomid at this stage is to challenge your ovaries to lead to the process of superovulation. So the number one step, if you have unexplained infertility, when you go to your fertility specialist, is to try what? Clomid challenge. So when we are giving you Clomid challenge, we are telling your ovaries to give us the eggs in the assumption that you have normal ovarian reserve. So number one in approaching unexplained infertility is what? Use of Clomid under the supervision of a fertility doctor. When we give you the Clomid, we are going to monitor the Clomid response. Normally, Clomid is given for 5 days. Then we monitor. If you have good outcome, then we proceed. If we don't have good outcome, we can review and we can upgrade and we can go again. Now, number two, when you have done the Clomid challenge and you're still not pregnant, at that point, we'll begin to consider assisted reproductive technique. Now, number one assisted reproductive technique we can consider is what we call IUI, intrauterine insemination. So intrauterine insemination means instead of allowing the penis to deposit the sperm, we're going to collect the sperm from the man. We are going to concentrate the sperm. We're going to wash the sperm. Then we carefully introduce the sperm directly into the womb cavity. Now, when we are doing this, we have to confirm when the woman will ovulate. So this type of IUI is called IUI with natural ovulation. So we have to confirm that the woman is ovulating. Then we target when she will ovulate and introduce the sperm directly inside the womb. By the time we are introducing the sperm directly inside the womb, what are we doing? We are now creating a closer environment for the sperm to get to the tubes. So this is the next step when Clomid fails. Now, if we try this stage and we didn't succeed, remember it's natural. So we are not placing this lady on any Clomid. When IUI with natural ovulation fails, we can combine IUI with Clomid. So look at the difference. The first one is IUI without Clomid, just with your natural ovulation. But when that one fails, we can combine intrauterine insemination, also called artificial insemination, with use of Clomid. Now, when we are doing this, we are going to try it for 4 cycles. Very important. So remember, the first one, we try Clomid alone. If it fails, we step up to natural ovulation and IUI. If that one fails, we try IUI with the help of Clomid for 4 cycles. When this fails, we step up. So if you notice, management of unexplained infertility is a stepwise process. When Clomid combined with IUI fails after the 4th cycle, we are going to graduate to injectable fertility drugs. The reason why we are going to use injectable fertility drug is because it's faster in achieving superovulation. Remember that what we are trying to do is to achieve superovulation. Superovulation means we don't just want to release one egg. We want to release multiple eggs at the same time. So when we are giving you injectable fertility drugs, they work faster than Clomid. So consider using injectable drugs alone. When that fails, we can now consider combining IUI with injectable drugs. So if you notice, there's a build-up. Number one, try your Clomid. If it fails, go for IUI with your natural ovulation. When that fails, you go for IUI with Clomid. When that fails, you try injectable fertility drugs alone. When that fails, you try IUI with injectable drugs. Now, one of the risk factors, which is actually commendable, which is actually desirable, when you're going for treatment for unexplained infertility, is the possibility of having multiple pregnancy. Anytime we're giving you any of these superovulation drugs, the possibility you're going to have more than one baby is high. So anytime you're taking Clomid, Clomid can lead to multiple pregnancy. So we have to be careful in this context. So if your body is not good to conduct and carry and nurture a pregnancy that will be more than one, we have to be careful. Now, if we consider the IUI with injection and it fails, the final step we have to take is what? To go for IVF. So the ultimate in unexplained infertility is what? IVF. So unexplained infertility, regardless of the duration, regardless of what you've done in the past, if we confirm that you are okay, and the only person that will confirm you are okay is who? A fertility specialist. You see, it's very easy for you to just be on your own corner and say, oh, doc, I've done everything, we don't have a problem. That's not enough. A fertility specialist will check and make sure that you're okay. When that happens, then we follow the steps. So the first step is to challenge you with Clomid. When that fails, we try IUI without any support. When that fails, we try IUI with Clomid. When that fails, we try injectables alone. When that fails, we try IUI with injectables. Then if eventually fails, we graduate to IVF. Now, by the time we've tried all this, from what we know, one of them would have worked. Now, remember, when you have unexplained infertility, it's a very serious diagnosis because we want to know what's going on. So not doing anything is not an option. You have to do something. You have to at least have a fertility specialist working with you. So the common denominator in managing unexplained infertility is what? A fertility specialist. So it's a fertility specialist that will know what to do at any stage you encounter difficulty. Okay, so very, very, very important, straight to point topic. It's possible that if you're attending this clinic right now, they might have told you everything is okay and you don't have your baby. So most questions will be, why don't I have my baby if you're telling me everything is okay? So where are my babies? Okay, now I'm going to give us an opportunity to ask questions. So the clinic is open now. Please feel free to ask your questions. I'm going to take care of your questions right now. Okay, so one question says, how does endometriosis factor into unexplained infertility? Now, endometriosis as an entity is already a factor that can lead to infertility. So if you have endometriosis, at that stage, you no longer have unexplained infertility. So unexplained infertility means would have ruled out anything that might cause infertility in you. So if we notice, if we diagnose endometriosis, endometriosis is an independent factor that can lead to female infertility. So at the stage we are diagnosing endometriosis, we have to start managing the endometriosis as an independent factor that might likely be leading to the delay. So once you have endometriosis, you don't qualify to be called unexplained infertility. Okay? So endometriosis, unfortunately, is a factor that can affect a lot of women. Treatment can differ depending on the severity. We can give you drugs. We can go for surgery. We can combine a lot of things. It's a very, very common thing that happens to women. There are so many women that might have it, they won't even know they have it. Okay? Okay. How common is unexplained infertility? Very, very common. It's pretty common. Okay? Very, very common. Now, for us to know, you have to go to a fertility specialist. So there is no assumption. Now, this is where our members are not getting it right. You see, it's very easy to go emotional. It's very easy to complain. It's very easy to say, you've done this, you've done that. The truth remains, there is a cutoff point where your understanding ends. So once you've done your own PPP and you're not getting results, at that stage, you have graduated to seeking help from a professional. So please, this is September. So don't just wait and assume or complain to the whole community without seeking for help. Unexplained infertility is common. Very, very common. Matter of fact, if you don't have a fertility specialist attached to you, if they haven't told you that the reason why you don't have a baby is your tube, is your hormone, is your ovary, is this, is that, then it's assumed you have unexplained infertility until proven otherwise. So it's common, but it's mostly undiagnosed because most people do not seek help until it's late. Okay? Very important. How possible is practicing PPP in achieving pregnancy in unexplained infertility? Like I told us earlier today, regardless of what your diagnosis is, you can still become pregnant. Capture this for me. Regardless of your diagnosis of infertility, you can spontaneously become pregnant. Why? Because that factor can correct itself. We've had situations where women went for series of IVF. And when those IVF failed and they couldn't have money to go for IVF further, they became pregnant naturally. Let me give you an example. You see your tubes? They might tell you you have blocked tubes. And the level of your blockage might just be mild blockage. And you went for HSG. So when you're going for HSG, what do we normally do? We introduce a fluid through the vagina. Then we take a picture when we pass through that fluid to know if your tubes are open. So what's going to happen if you have a mild blockage? Those fluid will dislodge it. So in as much as previously they told you you have blocked tubes, we have now corrected our blocked tubes without you knowing. So if you go back and you continue your PPP, what's going to happen? The eggs are going to be released. They're going to enter the tubes. You're going to get pregnant. Now, this is the criteria that so many women climb, the podium in their church, and they begin to give testimonies. Oh, they told me my womb was missing. Oh, they told me I have blocked tubes, and I still became pregnant. Naturally and conventionally, when your tubes are blocked naturally, you cannot become pregnant medically. But the reason why you became pregnant is because everything worked perfectly. So PPP is a method that works for so many people. So even when you're told you have unexplained infertility, because there are so many things we don't know. In medical practice, it will surprise you that up to now, we don't know what causes hypertension, diabetes. We don't know. We know the risk factors, but we don't know the exact thing that causes diabetes and hypertension. It's still unknown. So there are so many things we don't know. So even in unexplained infertility, the fact you have it doesn't mean you don't continue naturally. You still have to continue making love with your partner, praying, and doing the right things. So you can defeat unexplained infertility still with PPP. Okay? So there are so many things I don't know as a doctor. The ones I know, I share my knowledge, but it's left for you to continue trying the natural way of becoming pregnant. Very important question. I love that. How does the age of a woman factor into unexplained infertility? The age of a woman is the most important factor in becoming pregnant. Because as you're aging, when you get to 35, you have a sharp reduction in both the quantity and the quality of your eggs. So your fertility will decline. So depending on the age the unexplained infertility was diagnosed, you might have a better chance if you're younger in still succeeding, because one of the criteria we will use in checking the diagnosis is to look at your ovarian reserve anyway. So if we check your ovarian reserve at 40 and you no longer have eggs, that means you've gone into premature menopause. When you no longer have eggs, you will not be able to achieve pregnancy naturally. So age is very critical. The best time for you to have all your babies is when you're in your 20s. As you're getting older, it begins to be difficult. It begins to be difficult. So the most important factor in a woman's life, if she wants to be a mother, is her age. This is why you need to act. So if you are 34 in September, it's a wake-up call for you. If you haven't started your family and you're 34, by next year you will graduate to advance in maternal age. So your age is very important. Now listen to me carefully. The fact you advance in maternal age doesn't mean you can't become pregnant. We've seen women that became pregnant naturally at the age of 50, but the chances are limited. So you have to take your chance while you're waiting on God. Then you need to deal with factors you can't change. Nobody can change their age. That's the way God made it. So we are all going to age. And aging is a good thing. But you need to know your chance at any given time. Okay? I love that question. Okay. Hello, Doc. Are there symptoms of unexplained infertility? So here's the deal. It's unexplained. So most times when we go out there, we don't see any symptoms, right? So everything is good. Your tubes are good. No problem. Everything is going good. So that's actually part of the pathway of unexplained infertility. So most women and most men that will have unexplained infertility won't have any symptoms. When you have symptoms, we can begin to attract those symptoms to know why. But most people that have unexplained infertility will also have no symptoms. And that makes it more frustrating. Okay? Are there food that can aid pregnancy in unexplained infertility? Guess what? Generally, when you eat good food, when you eat food that will give you superfood effect, your fruits and vegetables, you will need to eat all the food, but in the right quantity, right? So when you embrace your fruits and vegetables, you drink your water, you limit your alcohol, you don't take recreational drugs, you don't smoke, you're pretty much setting yourself up for good. But the problem is, when we eat a lot, when what we eat contains a lot of calories, when we are not getting the basic nutrients we need in the food, it can further affect our hormones. Women are very sensitive. So when you eat right, you will have an opportunity to improve your natural fertility. So that's the way it works. Some people will come and say, Doc, what can I use to boost my fertility? There is no such thing. That's a fact. Once your eggs are gone, they are gone. So you can't boost the eggs because what you have is what you use. But for men produce their sperm every 3 months. So that's the difference. Okay? Very good questions I'm getting. So please, if you still have questions, still ask so we can wrap up. So remember, today we are looking at how you can defeat unexplained infertility and actually succeed in becoming pregnant and becoming a mother. That's the topic for today. So please, if you haven't subscribed to our channel, make sure you subscribe today. Make sure you click on the notification button so they will tell you anytime I'm coming live. Share the channel, comment, ask all your questions, review previous videos. There are so many videos out there that will help you to know your body better. Okay, so thank you so much. If we have any other further question, you can ask. If not, we can adjourn for today. Ebenezer, when you can, share the topic for tomorrow. And tomorrow we start the conversation and continue where we start. Okay? But if you have questions, still go ahead and ask. Okay? Remember that unexplained infertility management is a stepwise process. Number one, we have to confirm you have unexplained infertility. So you go back to do all those investigations, female fertility testing, male fertility testing, which is baseline anyway. When we are done doing that and we confirm everything is good, then you step up with Clomid challenge. When Clomid fails, we escalate with IUI natural. When that one fails, we escalate with IUI with Clomid. When that one fails, we go for injectables. When injectable fails, we combine it with IUI. When it fails, ultimately, then we go for IVF. So IVF is on the top echelon of management of unexplained infertility. Okay, the topic tomorrow is when adoption is the only option. Beautiful topic. When adoption is the only option of becoming a parent. That's the completion of that particular topic. When adoption is the only option to become a parent. Very important topic. You don't want to miss this. Remember, there are different ways you can be a mother. You can be a mother naturally. You can go for fertility treatment. You can go for IUI. You can go for IVF. You can go for donor egg, donor sperm. You can go for surrogacy. And ultimately, you can go for adoption. There is no difference. It's the same thing. So if adoption is your only solution, what are you going to do about it? Especially if you're in a place like Nigeria. So that's what we're going to talk about tomorrow. But whatever happens, use all your options. How can a woman fight depression in unexplained infertility? By acquiring the knowledge, just like we've been discussing. If you notice, I discussed depression and infertility the other day. When you actually know you're depressed, how do you know you're depressed? You seek help. Some people might be depressed, but they won't even know. They will be going to church. They'll be telling them they're possessed. You're not possessed, my sister. There's a medical explanation to what you're having. So how do you fight depression? If we diagnose you have depression, then you go for depression management. If we give you drugs, you take your drugs. If you're going for counseling, you do that. Then you also change your lifestyle. When you exercise, when you sleep, when you eat good food, when you avoid stress, you can help yourself better to defeat depression. Anybody can be depressed. Matter of fact, at some point in life, 99% of us might have had depression without knowing. So long as you're in this world, especially if you're a Nigerian, the possibility you've been depressed several times is there. But most times when we overcome things, we don't even know how we overcame them. But please, there are clinically diagnosed depression. And depression can be mild depression, moderate depression, or major depressive episode. And it's deadly. Some people that are depressed can have suicidal tendencies, okay? So you need medical treatment. It's completely treatable. The fact you have depression doesn't mean you can't become a mother. And unexplained infertility can actually be a risk factor of developing depression. And depression can also be a risk factor of developing unexplained infertility. So they have a synergy. Okay? Very good question. I love that. Do we have any other question? Let's wrap it up at 25 minutes. If you have any other question, please go ahead and ask. I'll provide you feedbacks. Join me tomorrow about the same time. We're going to talk about adoption, when adoption is the only option you have to becoming a parent. Don't miss that particular topic. Okay? So give me a signal if we're good so I can go. Thank you for coming. I appreciate you. If you're just coming in, we're just talking about how you can achieve pregnancy in unexplained infertility. And in unexplained infertility, it simply means we have checked you as the woman. You are 100% okay. We have checked your partner is 100% okay. But still, you are not able to achieve pregnancy. When you have that condition, you have unexplained or infertility of unknown origin. And I gave different steps of how you can get help. Number one, you go for Clomid challenge. You go for natural IUI. You go for Clomid with IUI. Then you go for injectables. You go for injectable with IUI. Then ultimately you go for IVF. Okay? So thank you so much for coming. I appreciate you guys. I'll see you guys tomorrow. Bye-bye for now.